Hi there, my name is Peter Carvel and I want to welcome you to Massage for Friends and Family. Now you know people buy this DVD for many different reasons. Some people just want to learn a new skill, while others would like to surprise a family member or a partner with a massage. Some people are even thinking of becoming professional massage therapists and want to see if it's really for them and if they'd like to do it for a profession. No matter what your reason, the matter of the fact is you bought this DVD because you'd like to learn how to massage. And over the next hour or so, we're going to teach you routines and techniques to a level where you can feel comfortable, not only giving a relaxing, but also an effective back and neck massage. Now, we're not saying you'll be a professional massage therapist after all of this, but as you'll learn, there's a middle ground between not knowing any techniques and the skills of a professional massage therapist that we all can learn and enjoy. Let's move straight on to the next section where we'll start looking at the tools and the preparation you need to do before you can start your massage. Now before we have a look at the actual tools you need to do your massage with, let's quickly look at something else a lot more important, something called contraindications. Now contraindications is a list of conditions or state that the body can be in during which time you can't give someone a normal massage or massage at all. Let's quickly look at these conditions. Now the first group of contraindications is called total contraindications, and if anyone has any one of these conditions, they're not allowed to have a massage at all. Let's quickly look at some of them. Fever, contagious or infectious disease including any cold or flu, no matter how mild it may seem. Anyone under the influence of drugs or alcohol, including prescription pain medication. Anyone who's got recent operation or acute injuries, and anyone with neuritis or any skin diseases. The second group of contraindications is called local contraindications, and you're just not allowed to massage over the affected area. Let's look at some of them. Varicose veins, undiagnosed lumps or bumps, pregnancy, cuts or abrasions, sunburn, undiagnosed pain, and any inflammation including arthritis. The third group is called medical contraindications, and you have to get permission from a practitioner or a doctor before you can massage anyone with one of these conditions. Anyone with cardiovascular conditions, any conditions already being treated by a medical practitioner, heart problems, angina, anyone with a pacemaker. And then all of the following. If you want to stop your DVD and have a look at all these conditions, you can do that. We're going to move on to the next section now where we will look at the actual tools you need to do your massage with. Now the first tool I want to talk about is probably the most obvious, and that is oils. Now, unless you're a professional aromatherapist, I wouldn't recommend you use any aromatherapy oil or essential oil. What you could do is go down to your local aromatherapist and have him or her make up oil for you, which you can then use on your friends and family. What I do recommend for non-professionals is what is known as base oils or carrier oils. There are many of these, but the two most common ones are sweet almond oil and grapeseed oil. Sweet almond oil is a little bit more expensive, but grapeseed oil is a lot less expensive and just as effective. In fact, a lot of professionals use grapeseed oil because it's so cost effective. Now when you start preparing your oil for a massage, it's always good to put it in a container that's safe, easy accessible and won't spill or break. Therefore I use a little plastic container like this with a flip top that you can easily use with one hand, open and close it, put it in your pocket when you don't need it, and take it out and apply some more oil when you do. You can also use a container like this, but like I say, it can spill, it can be awkward, and it's just not very relaxing for the person that's being massaged. Now another thing that professional massage therapists do is to take a little container like this, fill it up 3/4 with some warm water, and just before the massage they leave their little oil container for 10-15 minutes in there just so the oil can get nice and warm. When they take it out and they start applying the oil to the person they're massaging, they don't get a fright because of cold oil touching their body. Now most people think that towels is just there to look good, but when you become a professional massage therapist, one of the most important things they teach you is towel technique. Mainly because keeping the modesty of a client can be the difference between a good massage and a bad massage. Now I'm not going to teach you all the techniques a professional needs to know, but the two basics are make sure everything that's not being massaged is covered, and also make sure everything that's just been massaged is also covered to keep it nice and warm. If you have a couple of bath sheets and maybe 2 or 3 hand towels, that should be more than enough. Apart from that, make sure everything that needs to be covered is covered and you should be okay. Now before you massage someone, you probably want him or her to lie down somewhere. One thing you do not want to do is massage anyone on the bed, mainly because it gives away. And the more you press and massage, the more it gives away and it's just ineffective. Rather get a nice tabletop or a carpet floor and just put down a couple of duvets and let a person lie down on that. Always make sure you ask someone if he's comfortable. Now the next tool I want to talk about is probably the most important tool when it comes to setting a nice relaxing atmosphere and a mood in the room, and that's music. Now the few basic rules is make sure the music is not too loud, make sure your play is on continuous play, otherwise you might have to stop the massage to press another button, and also make sure you put the music on for 10 to 15 minutes before the massage so it can relax yourself and the person if he or she is around. As to what music to play, if you go into any music store and you go to instrumental section, you'll find a lot of suitable music to play for massaging. One word of caution is if you do play music like whale or bird songs or thunder or rain, make sure that the person you are massaging actually like it, as some people can find it irritating. Now the next tool is a tool that will assist music in giving a room a nice relaxed atmosphere and mood, and that is fragrance. Now unless you're a professional aromatherapist, you probably won't be using any aromatherapy oil or essential oil, so you'll need another way to get a nice fragrance in a room. Two ways of doing it is getting a nice little fragrance burner like this. We'll get a nice little fragrance oil that you can put in the top, you'll have a candle at the bottom and you'll light it, and when the oil evaporates it gives a nice fragrance to the room. Another way you can do it is to use candle sticks or scent sticks. One word of caution is when you do use scent sticks, it can be very strong and can irritate people. Make sure you ask the person that's being massaged if he actually enjoys the smell and if he's alright with it. Now the last couple of things I want to talk about is something you'll do just before massage and then straight after. The first thing is to go and wash your hands in really warm water just before you do a massage. When you start touching someone, then they don't get a fright because of cold hands, because believe me, there's nothing more irritating if you have a massage than your therapist having cold hands and touching your body. The last thing is a nice glass of cold water, because giving a massage can be quite demanding, and also receiving a massage moves a lot of the systems around in the body, and it's not uncommon for someone to be very thirsty after a massage. Now that you have all the tools, let's move on to the next section where we'll look at the very last thing you'll do just before you start a massage. Now the very last thing you want to do just before you start a massage is to do a mental checklist, just to make sure you've got everything there that you need to do the massage with. So make sure you've got your oil, your towels, your drink, make sure you've taken your watch off, and make sure you don't have to go away in the middle of a session to go and find something that you should have had there in the first place. Once you know you've got everything, go and stand beside the person you're massaging, put your hand on his or hers back and start counting back from 15. As you count back, breathe in through your nose and out through your mouth. By the time you get to 1, you'll be nice, relaxed and ready to give a massage. Now we're going to move to the next section now, where we're going to start looking at the massaging techniques. We're going to start with the warm-up. What I'm going to do is tell you what each technique or move is called, and then tell you how to learn it and teach it yourself, and then I'm going to let a therapist show you a couple more times so you can watch and learn. After that I'm going to keep quiet, because I know a lot of people will be watching this DVD while they're actually learning how to massage, and it's going to be very irritating if someone keeps talking all the time. Let's move on to the next section now, where we will learn how to massage. Now the first thing you want to do is apply oil. See how the therapist is putting oil in the hand rather than straight onto a client's body, mainly because if the oil is cold you can warm it up and then start applying it. The first couple of moves we're going to learn is called efferaging moves. Now efferaging moves got 3 purposes. First is to spread the oil, second is to warm the muscles up, and third is to acquaint yourself with the person you are massaging and him or her with you as the therapist. Now the first move is very straightforward. You start at the bottom of the spine, move up the spine and then down the sides. You do this in 3 sections until you get to the top, then you move around the shoulders and all the way back to the spine. At this stage the pressure is very light. See how the therapist is stopping there? She'll be doing that before every new move she's teaching us. Now the second move is very much like the first one, but almost in reverse. You start at the top, move around the shoulders, come back to the spine, and then push back off. Come back to the spine once again and push back down. You'll do this once again in 3 sections until you get to the bottom of the spine and move all the way to the top, and do it another 2 or 3 times. You can increase the pressure at this stage very slightly, but the pressure is still very light. Now the next move is a friction move, and at this stage you do not want to apply a lot of pressure, mainly because you can burn the skin if you move too fast. It's a very quick movement up and down, and you start from the one side of the body and move all the way to the other side. This movement gets the body and muscles warm very quickly. Now the next move is what is known as a knuckling movement. Basically you take your hand and make a fist of it, and then move your knuckles up and down and apply pressure onto the client's body. You start at the bottom of the spine and then move your way up to the top of the spine and all the way around, down to the sides and back to the bottom of the spine. You can increase the pressure once again slightly, but it's still a very light pressure. Here you can see in more detail what the therapist is actually doing. Now the very last movement in the warm-up section is what I call spider walking. It's a very easy move to do and very relaxing and very rewarding. Basically what you're doing is putting your thumbs in front of each other and then pull them up by moving your hands and walking up the spine and back of your client. Once again, start from the one side of the body and move all the way to the other side, covering the whole back. Let's quickly look at this move in more detail. See when she takes her hand how she's actually pulling her thumb up by walking up the spine and the back of her client. Now the first move in the lower spine section is what is known as circular movements. The therapist is using her thumbs and just apply slight pressure on the coccyx, bottom of the spine, in little circular movements. From when you start with this movement until you end, you can increase the pressure slightly. The next move is a fanning move. Basically what you're doing here is anchoring your hands with your fingers and then apply pressure with the palm of your hand, tracking the hip bone of the person you are massaging. It's very important to apply pressure downwards and upwards with this move. You can do this 7 to 8 times before you move on to the next move. The next movement is called a ringing movement. Basically what you're doing once again is applying pressure upwards and downwards as you're moving your hands past each other. At this stage you can increase the pressure once again slightly, but still not a lot. Make sure you push down as well as pulling back up as you move your hands past each other. Now the next move you learn is just a pulling move. Basically take your hands as far down as you can by the side of your person you're massaging and then pull it all the way over the spine. Make sure you don't actually cross the spine and lift your hand up just before you get there. Make sure you apply pressure all the time from the moment you touch the body at the bottom all the way until you get to the spine. The next move is called kneading. It's a very straightforward move and you make sure you apply quite a lot of pressure at this stage. Basically what you're doing is make your hand in a V and move from side to side. See how the therapist is showing at this stage? That's exactly what you're doing, and you're just kneading the muscle slightly and then change hands. Now the first move we're going to do in the middle and upper back spine is just a very easy pressing movement. Basically what you're doing is crossing your thumbs and make sure each of them are exactly on one of your spine muscles, and you just push it very slightly all the way to the top of the spine and then come back around the side. At this stage you can increase the pressure once again very slightly. The second move in the middle, back and upper spine section is once again a nice kneading movement with the thumbs. Basically what you're doing is apply a fair amount of pressure and just alternate the thumbs as you go all the way up to the spine again, and then come back by the sides. Make sure that your hands that's supporting your thumbs at this stage is actually flat, otherwise you might hurt the person that's being massaging if it's in a fist. You can do this 2 to 3 times on each side of the spine. The next move is once again a knuckling movement. Similar to the one we did in the warm-up, you make your hand a fist again, and then just move the knuckles up and down one side of the spine. Make sure to cover the whole area from the bottom of the spine all the way up. At this stage you can increase the pressure once again very slightly. The next move is very similar to the first one we did in this section, and it's once again a kneading with the thumbs move. This is very similar to the move we just did, and it's moving up and down the spine, kneading towards the outside. For demonstration purposes, we're only going to show you the one side, but do make sure you do this move on both sides of the spine. The next move is similar to the one we did at the bottom of the spine, but this time we're just pressing down with the palms of our hands. You can use a similar pressure to the two moves we've done just before. Once again, remember to move up and down the spine. See how she's actually lifting her hands up to demonstrate that you only use the palm of your hand to push down. And remember to do it on both sides of the spine, not just the one as we're doing it just for demonstration purposes again. Now the next move we're going to teach you is a little friction and circular movement with the fingers once again, down the spine. What she's doing is supporting her index finger with her middle finger, and she's just doing little frictions down the spine and then pushing it down towards the side. You can once again use a similar pressure as the move you just did before. As the therapist is showing, make sure you support your index finger with your middle finger, otherwise you'll get very tired and you may injure yourself. Let's quickly look at this move in a little more detail so that you know exactly what to do. See how the therapist is making sure she's supporting her index finger with her middle finger, as this is very important with this move. Now the next move is very similar to the first move we did, where the thumbs were alternating on the same side of the spine. This time, however, they're doing separate sides of the spine, and you're just moving up all the way to the top of the spine and then come all the way back and do it 3 or 4 times. At this stage, you can increase the pressure once again slightly. Now the next move is a very simple, very straightforward move, but very effective. Basically what you're doing is putting your palms on each side of the spine and move it all the way up to the top and then come back down again. See how the therapist is lifting up her fingers to show you that she's not actually using her hands and only her palms. At this stage you can increase the pressure quite a bit just to make sure it's even more effective. Make sure you only push when you go upwards and not when you come back down again. Now the first move we're going to teach you with the neck and shoulders is what is known as kneading. It's a very common move as a lot of people do it naturally to each other. You basically take your hands in a V again and move towards the neck like she's doing now, and then just squeeze slightly to knead the muscles there. Make sure you go all the way to the neck like the therapist is doing. The next move is once again a knuckling move. You start just on the top of the shoulders and move all the way towards the neck. You can apply a fair bit of pressure here. Now the next move is kneading once again, but this time you'll use both hands on the same side of the neck. Make sure that you move all the way around from the shoulder to the neck and don't just knead in one area in one place. See how the therapist is demonstrating when she gets to the neck muscles, as it's still a kneading move, but it's a lot smaller. And she only uses her fingers rather than her whole hand. Now the next move is another knuckling move again, and what you do is just slightly knead all the way up towards the neck. Start at the shoulder, go up to the shoulder blade, and just bring it in towards the neck. Once again, make sure you do the whole muscle and don't just get stuck in one area. The next move is known as a fanning move, and you start at the top of the neck and move towards the shoulder, just applying slight pressure and quick movements. It's always good to work on one shoulder muscle and neck muscle first and then move to the other. It's a lot more effective. The therapist is now going to show us all the moves again on the other side. Whenever you do these moves, make sure you never cross the spine, only work on one side, as you can actually hurt and injure someone if you push on the actual spine. Now the next move is little circular movement with the fingers under actual neck muscles. You will see the therapist is starting on the shoulders and then move towards the top of the neck. All she's doing is just using very circular movements with a fair amount of pressure. Always remember throughout the massage that you're continuously asking the person that's being massaged if he's alright and if he's enjoying it. The next move is a very similar movement as the one that she just did, but this time she only used one hand. Then to finish off the shoulder and neck massage, it's always good to just do kneading for another 30 seconds or so. Now the next move is a very easy move once again. Take your hands all the way to the front of the shoulder and just pull it back, applying a fair amount of pressure. You can do this 2 or 3 times. Now in the end routine, we're not actually going to use any massage moves, but rather massage strokes. These are relaxing, light pressured strokes just to finish the massage off with. Now the first move is very similar to the first one we did when we warmed up. And you basically start at the top or the bottom and move up the spine and then press up towards the sides. The second move is very easy. You're basically just using your fingertips and start at the top and drag it down towards the bottom. Remember, all the moves at this stage are very light pressured and you do not apply pressure at all. Basically start the moves with just straight strokes and then later on start vibrating it from side to side a little bit as you bring it down towards the bottom. For the last move, we're going to walk around to the person we're massaging's head. And what we're going to do is move our hand all the way to the bottom of the spine and then do nice wide strokes all the way to the top. Start by doing nice wide strokes and then every stroke after that make it lighter and make it narrower. So that when you get to the end, you're doing a very light stroke right down the middle of the spine. Make sure that by the end you are barely touching the person's back. Then when you finish, hold both hands at the top of the spine and just press it slightly for 10 seconds. Then when you finish, get your towel and cover up the person's back that you've just massaged to make sure that you keep it nice and warm. Then what you do is put your hands side by side on the person's back and start rocking it slightly. Do this for 10 seconds or so, and by the end make sure you're actually standing still. Lift your hands up and you're finished with the massage. And that's all that's to it. I'm pretty sure you'll agree with me that it's not as difficult as a lot of people make it out to be. I hope you enjoyed learning a new skill on how to massage and you'll put it to good use. Don't forget to check out the contraindications before you massage any of your friends and family members. What will follow after this is 30 minutes of relaxing music and photos and pictures which you can massage your friends and family members too. Until next time, enjoy your newfound skill and good luck.